आपकी ऑडियो म्यूट है।
सर आवाज नहीं आ रही आपकी।
Oh, sorry, my mic was mute. So, Assalamu alaikum. Good evening, all honorable doctors. Today we will talk over the diabetes, role of the homeopathy in treating, in curing the patients suffering from diabetes. So there will be part of today's session. In this session, I will deliver a short introduction of the diabetes. What is diabetes? And in the second session, we will talk over the case. What was the case? How it was treated? And I will also share all the pathological reports, follow up the patient with you. So request to all of you, please mute your mic to avoid from any disturbance. So management of diabetes with homeopathy. So first, diabetes insipidus, and second is the diabetes mellitus. Insipidus, rare condition in which kidneys are unable to retain the water and is caused by the problem to hormone ADH, vasopressin, water conserving hormone. Diabetes mellitus is a condition characterized by the inability of body to produce enough or respond normally to insulin, causing blood sugar to be abnormally high. Globally, 500 million people are suffering from the diabetes. In USA, 36 to 37 million people. Each year, 60 to 70 million people are dying from this disease. So in every 5th second, one person dying from this disease in the world. So many types of complications occur, like myocardial infarction, EST end-stage renal disease, and the heart stroke, etc. So diabetes is not a single disease. It's a group of many diseases, and all diseases lumped together in a bag and form commonalities which are threat. Tendency for chronic hyperglycemia is a common threat, and this is less strain. It's metabolic derangement in our body, like protein, carbohydrates, metabolism, and the beta cell present in pancreas produce the insulin that is going to blood and acting on the receptors. So either there is a reduced insulin production or increased resistance to the action of cell. Diabetes is also called a killer disease. Why? Why it is called killer disease? Because it produces many complications in the body. Either that complication go for heart, for kidney, and at the end, if the person survive and the diabetes doesn't kill him, then he will be blind forever. That is also a very miserable life. So here are some types of diabetes mellitus. Type 1, reduced production of insulin, sometimes less or absent due to the beta cells, which are destroyed due to the autoimmune reaction. And type 1 is the younger age diabetes. Then type 2, here main problem is resistance to the action of insulin. Initial stage of the disease, there may be beta cells producing insulin on the normal level or more than the normal, but cells are not responding to insulin. As this disease go for year and year. Type 2 is an older age diabetes. Here I have shared a chart that how this disease is harmful with the growing age, with the growing years, how is proceed, how it progress more and more complication in the body. Latent autoimmune diabetes of adults, that is the LADA. It is called LADA. It's type 1 diabetes. So most of the younger of the LADA, if man is 40 or 50 years old, an autoimmune system destroy the beta cells. So if he at the very late age develop the autoimmune beta cells destructive, so this condition will be similar to type 1 and is LADA. This is very late onset. Then maturity onset diabetes of young, that is the MODY. If the patient at the age of 20 years, there is insulin level normal, but the insulin is unable to produce its action. So this disease start at very young age. MODY is caused by a mutation in the single gene and runs strongly in the families. Gestational diabetes, diabetes limited to females during the pregnancy. Secondary diabetes, use of drugs for the long time have the tendency of hyperglycemia. So we say a drug induced the diabetes. One of these drug, beta blocker, propranolol or thiazide, basically beta adrenergic receptors present on the beta cells. When not functioning, then insulin will not be released properly. And there will be dysfunction of production and release of insulin, and person will have tendency to develop hyperglycemia. Similarly, endocrine disease like Cushing syndrome, there is an elevation of the cortisol or stress hormone result in the hyperglycemia. These were some complications like cardiovascular disease, nerve damages, neuropathy, kidney damage, nephropathy, eye damage that is called the retinopathy, and then the hearing impairment and Alzheimer's disease, depression. These are the tests which are conducted to confirm the diabetes is there or not. HbA1c test, fasting and blood sugar test, glucose tolerance test, which is also called GTT, random blood sugar test. And here is some reading map of the diabetes. If the reading is above 6.5%, then it is the patient suffering from diabetes. Less than 6.5% is the pre-diabetes. And if the 5 points below 5.7%, then he is a normal person. So it was a short introduction of diabetes. Now we will proceed to our case, how homeopathy cured this patient. What is the role of homeopathy? As we and all of you know, that the homeopathy work on the patient. Whatever the disease is there, it produces some symptoms, it produces some changes in the patient. And what may be the changes there? That changes may be in the patient's state of mind. That change may be in the PQRS, peculiar, koi, rare symptoms, or there may be change in the mind symptoms. So we have to see the patient. When the patients visit us, then what's his present state of the mind? What is his concern? Why patient come to us? What he wants from us? So if we take the answer of these questions, then we can easily select the right simulum of the patient. So that is the case. Patient name Abdul Kafur, age 54 years, complained of the diabetes and visited me on the 25 July 2021. I have been suffering from the sugar since 2009. it remains so high that I have to use metformin 850 milligram regularly. Someone told me to use tamarind to control the sugar, but my sugar exceeded up to random 500. I got so serious that my son shifted me to the Kajazam hospital. After taking treatment and further medicine, decreased my sugar. In the meantime, my friend who got successful treatment from you referred me to consult you, but again, same situation happened and the sugar got so worse and raised to random 730. My sons didn't take any risk and again to the hospital. But it didn't become stable and fasting fluctuate to 170, 180, 225, 250. This time, I can't refuse my friend and I came to you. Nothing should be kept secret from the doctor. I am telling you the truth. This sugar sac ruined me and all my desires have been diminished. Rice, sweet seems as I am having the poison. I am on the diet, but to no avail of dieting. In 2004, I was in Saudi Arabia. I counted 39 bugs who sucked my blood. Other reason was my roommate told me not to share the meal with him. Otherwise, I will get the sugar. Even then, I share meal many times with him. Symptoms appeared like thirst increase. My sugar was confirmed by the doctor. And he told me that this is due to bugs bite. Who told? Doctor told him. I returned to Pakistan in 2009, have severe itching and sugar. But I didn't told my family about the sugar. They served me with lemon soda and other sweets, like which made my health more critical. And then I have already told you what happened to me then. I came to you know for the better treatment. I know I am using heavy dose, which will definitely damage the kidney, liver, or heart. Do something so that I get rid of this heavy doses of medicine. Doctor, I have no fear or intention in my mind. Everybody has to die. Then why fear or anxiety? My children are grown up and doing the job. It's my life principle that I request once for any task, never second time. I have taken too much of your precious time. Sorry. And none of your patients have discussed with you in too much details like me. In 2004, when I was in Saudi, I was summoned in the court in respect of the case. Summoned in a court in respect of the case filed against by my first wife and children. I was accused of not fulfilling my duties.
Sir, was slow.
I was not accused of not fulfilling my duties. The court has issued arrest warrants. I came to know through different sources that I will be arrested on the airport and my house will be auctioned. I was caught in from these bad news. I was thinking that I am the man of reputed and political influence, so on arrest. I will lose my house and honor. What will become of my second wife and children? As I already, first wife and children snatched my property. I faced the case in the court and won it. Doctor, I have good relation with all political parties and all reputed politicians. So every politician know me and my principles. This was the case. So how I have solved it. So if we go through the case, the patient said, Doctor, this disease ruined me. This disease ruined me, sacked me, and all my desires diminished. So here he is complaining about the disease. So the first rubric was complaining disease of. Then the patient said, I am the man of principle. When I say something to my son or to any person, or I can say to you, that it is my principle of life that I say only once. I never repeat again. So he is a dogmatic. Third rubric was conscientious about trifles. As you know, that he told me that my fasting fluctuate to 170, 180, 225, 250. And then one more thing, which is very interesting. So what was that? He told that 39 bugs bite me. Can you imagine that a person who is biting by the bugs, and even he is counting how many bugs is biting to him? Can you imagine? So here I have taken the conscientious about trifles. He is telling a minor to minor details, and he is sharing with the minor details with the doctor. Then perseverance. Why I have taken the perseverance here? There are two reasons. First, he taking the treatment regularly. Second reason is that there is no change in the state of the mind of the patient. Still, he has no fear. Still, he has no anxiety. So his state of mind is very stable. I have taken here the rubric perseverance. Then business talk. Why I have taken the business talk? Because he told everything, to which hospital he visited, what medicine he is taking, how much time he is taking. So if the patient told about the hospital visit, about the medicine he is taking, about the disease, whatever to disease him, then here we talk delirium business talk of. Another rubric was the mind loquacity busy. It have only two medicine. First Lachesis and second is another one. I will share the video with you, and you will see that patient didn't take a 1 second rest. He was speaking in a very flow. He never take 1 second rest, and giving all the details, sharing all of the detail with me. So loquacity busy. Then cautious. Why have I taken cautious? Because what the patient said, doctor, I know this medicine will damage my kidney, my heart. So please do something to prevent me from the heavy doses of the medicine. So I have taken here cautious. He want to take some necessary or precautionary measures. So the rubric was the cautious. Here the medicine was Lachesis. I have two analyses for this patient. As you know, the patient was the man of principle. So I cannot leave this rubric, dogmatic and complaining disease out. These were the two confirmed rubrics which I cannot skip. So on these two rubric, medicine was Lachesis. But if we go through the case, something like this. I have a good relation with all political parties and all reputed politicians. Every politician know me and my principle. What is this? Pompous important. If we apply this regularly, then the medicine will be Homoeopathic. But Homoeopathic will not cover the dogmatic and complaining disease. So these two rubrics were the confirmed. So I have skipped pompous important. And one another thing, patient told me that I am telling all the truth. So telling the truth rubric covers only Homoeopathic, not Lachesis. So I have taken here delusion religious. So the medicine was Lachesis. I have used the Lachesis 6 first time, 3 doses, then OD for 2 days, repeated once a week. But when the HbA1c level was 7.5, then I moved to the Lachesis LM for 10 days and then once a week. This patient was with me for 3 months only. Then last week, I contacted him for the more follow-ups. He said, I'm okay, using all sweets, rice, sugarcane juice, and with not a single medicine of sugar. And today he sent me fresh reports on my request. This patient visited to me on the 25 July. So his treatments was to the October 2021. And then after that, from October 2021 to till date, he didn't use any medicine. Here you can see okay, that was another. So that was the case which I have shared with you. Now, when he visited me, his sugar was more than 400 at that time. So after taking the medicine Lachesis 6, I advise him to take the random test. After 1 week, his sugar was through glucometer 259. Here you can see the report. $152. Then 118. Here you can see his HbA1c level was 7.5 and his fasting sugar was 119. So here I have started using Lachesis LM. Then what happened? After using the Lachesis LM, he was the diabetic, but after using the Lachesis LM, HbA1c level decreased to 6.5, and he changed from diabetic to pre-diabetic, and fasting sugar was 129. His other pathological reports: cholesterol level, HDL, LDL, triglycerides, they were all in the normal range. That was his fresh report, which I requested him to please send me the fresh reports, your medical reports. That was 30 March 2022. You see here, urine was clear. There was no glucose in the urine, no any infection, no epithelial cells, no pus cells there, no proteins was there. And that is was the random sugar, which I am astonished to see. Random was 83. He has taken the meal at 12 p.m. and this test was conducted at 4 p.m. So after 4 hours, his random sugar was only 83. Right now? So, and the other RFT, urea was normal, creatinine was normal, only there was a minor increase in uric acid. Rest all of the pathology was the normal. And one more is patient audio. I will also share with you.
जनाब नवीद इकबाल अवान साहब अस्सलाम वालेकुम। मेरा नाम है अलहाज अब्दुल गफूर अब्बासी, पीर वदाई मोड़ में मेरा घर है। मेरा 2004 में मुझे शुगर हुई, तो 2021 तक मैं गोलियां खाता रहा, गुलजामेंट 50 850, तो मेरी शुगर 400 450 ऐसे रही और मैं कमजोर भी बहुत हो गया, बिल्कुल चलने के काबिल नहीं था। तो ये नवीद इकबाल अवान साहब ने मेरा इलाज किया है अली होम्योपैथिक क्लिनिक, जो चूड़ डीपुर के पास है। इन्होंने मेरा इलाज किया 90 दिन में। जो इलाज इन्होंने किया है उससे मैं काफी बेहतर हूँ। तो अब मेरी शुगर जो है ना 130 पे होती है या 35 पे जाती है, इतनी है। अभी मैंने गोलियां मैं नहीं खा रहा। इन्होंने 90 दिन का जो इलाज है इनका माशाल्लाह बहुत बेहतर इन्होंने इलाज किया है।
So that was his audio follow, as he was saying that my sugar, now my sugar is 130, 135 random. But when I have asked him to take the fresh test, I was astonished to see that it was the 83. Secondly, he is saying that he is using not a single medicine, and he was suffering from 13 years from the sugar. Now he is taking the sweet, he is taking the sugar cane, rice taking, everything he is taking, and living a very normal life. So it's the miracle of the homeopathy. So that was the case. One more thing I want to share here, that this patient was not only limited to medicine. I have shared the one more thing with the patient, and that was the food chart. I have taken from the internet the food chart, which is advised for the diabetic patient, and I asked him to strictly follow. And whatever I asked you, I'm going to tell you, please follow the strictly. So after 3 months, there is no further medicine. He has already said, doctor, you have said that in the 90 days I will be recovered. So I am now recovered now. I don't need of any medicine now. So he is in the telephonic follow-up with me still to date, and rest all of the pathology I have shared with you. Thank you very much.
Thank you, sir.
सर बहुत बढ़िया, थैंक यू सो मच सर, बहुत बढ़िया सेशन रहा।
You're welcome. You're welcome.